very young population in the Aboriginal population. Around 50% of our population are under the age of 25 compared to 30% of the non-Aboriginal population. And so we've got a big burden of disease.
There's a lot of people that actually don't know about it, and there's a lot of people that actually are very reluctant to be able to be open when it comes to that conversation. And one of the biggest passions for us is that we're delivering sexual health to young girls that have got STDs.
But the misconception is that you can't speak about the topic at all, which is not true.
Aboriginal people are diverse. Their experiences are diverse from one community to the next, regardless of their region or being part of the same language group. And individuals' experiences and needs are going to be different from one person to the next.
A lot of health professionals misread a lot of our cultural practices. When they start speaking about sexual health and blood-borne viruses, you'll have the Aboriginal person drop their head or look away, and sometimes there's silence. So they see that as, they're not comfortable. But silence is a big part of how we communicate, and silence is okay.
That's probably part and parcel of the job, to actually break down those barriers and to be honest and speak openly about it, because it is an issue that has never ever been discussed with a lot of people that we're actually involved in. And generally we get a really good reaction because we want to make sure their health is they've got half a chance or more than a chance, and that's a very big part of their life.
Sexual health and STI testing and those sorts of issues are the responsibility of all health professionals, from health workers to nurses to doctors.
We need to increase our testing rates, and we need to normalise testing within our routine health checks in our health services. Most STIs you don't even know that you've got, like your chlamydia, your gonorrhea, and some of your blood-borne viruses as well, HIV, they're asymptomatic at first. So you don't know that you've actually got, these infections. So it's so important that's why we need to be testing people who are coming in for other reasons, because people don't know if they have an infection unless you've been tested.
One thing that people can do that work in clinics is to normalise STI and blood-borne virus testing. So, for instance, when young people come to the clinic, we're offering all young people a chlamydia test or a gonorrhea test. Make it normal, do it, have no shame about it, don't ask the people you're most familiar with.
What if they have a client or a patient come in, and it could be for something else? I always say don't miss the opportunity. And sometimes you have to jolly them along. And you do that, and most people are okay. Oh, all right, I'll do it, So yeah, but it's just taking advantage of that they're actually there.
Take your lead from your client, doing it in a respectful way, not too much eye contact, and just and making it a normal part of your practice, not making it something that's too special to talk about almost.
When I've seen other nurses or practitioners, particularly if they are non-Indigenous, sort of respectfully approach people around talking about sexual health, you usually find that there's actually not a lot of shame, that people are really appreciative and happy that somebody has actually offered an STI screen or has been confident and comfortable enough to have that conversation with them.
Create a safe space for them and their client. They need to, be non-judgmental, supportive, and still have a bit of fun with them as well and have a little bit of a laugh.
Blanket statements that it's inappropriate, I guess, for health professionals that are of the opposite gender to talk to, to talk to people about sexual health really don't apply.
We are sort of finding that it is changing a little bit. Men don't mind having to sit in if there's just a female nurse or a female health worker.
In my practice, what I will say to an Aboriginal male is I know in a perfect world it really should be a male talking to you right now about sexual health, but because of service constraints, I meet, is it okay? Can we go ahead and discuss this stuff? And most of the time, the guys will go, oh, yep, no, and then you just get on with your job.
The other point also to make clear to each Aboriginal individual is the confidentiality.
I guess in terms of the rights of Aboriginal people to have safe, pleasurable sexual experiences, is that while we continually, I guess, are fearful around gender issues and sexual health, people are potentially not getting their needs met by the health service.